to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir,
I love that MAGA knows they've lost this issue so tremendously that the path is to just, well, lie until after the midterms and then we can do damage control, as, you know, the cuts won't kick in yet and then it won't be Trump. So maybe we can say, I didn't agree with Trump on this. The amount of cuts to Medicaid actually grows larger and larger each year, where by 2030, we'll be chopping $100 billion a year for the next 5 years from this program. Again, almost 15 million people will be put off of healthcare because of this. This is, I mean, it affects them in multiple ways also. It's not even just directly like work requirements, which is what Republicans want to focus most of it on because they feel like that's the most defensible, but there's also cuts to like payment providers at rural hospitals that'll leave hundreds closing. We've covered this at length. It'll leave I just said the 15 million kicked off healthcare. Those lucky enough to stay on healthcare though, to keep their Medicaid, will be left with unexpected higher out-of-pocket costs as there's now additional like medical costs, bills that won't be covered by insurance. It's a straightforward attack on health coverage on the poorest group of Americans while pretending to care about chronic disease, something that disproportionately affects that same group.